Did you know that catching the early signs of diabetes can significantly alter the course of your health, especially for women over 40? Today, we're diving deep into the 7 early signs of diabetes in women above 40, a topic that could be a game changer for your health and well-being. Don't forget to hit the like button, subscribe, and ring the bell for more life-saving insights. Stick around till the end for some awesome free gifts and the #1 unusual hormonal condition that affects many women, particularly those of reproductive age. Recognizing the early signs of diabetes is crucial for women over 40, as they are at an increased risk of developing the condition. Here are some common symptoms to watch out for. 7. Frequent urination and increased thirst. Experiencing frequent urination and increased thirst can be early signs of diabetes. When blood glucose levels are high, the kidneys try to remove the excess sugar by producing more urine, leading to increased frequency of urination. This process not only leads to dehydration, causing an unquenchable thirst, but it also signals that your body might be running on emergency mode, burning fat and muscle for energy. This unexpected shift in metabolism results in unexplained weight loss. Imagine noticing your weight drop without any changes to your diet or exercise routine. While it may seem like a fortuitous turn of events, it's actually a red flag waving high. This weight loss isn't the healthy kind. It's your body signaling that it's not managing glucose effectively, resorting to consuming its own energy reserves. It's akin to your body being in a continuous, unsolicited marathon, depleting muscle and fat, leaving you weaker and your health on shaky ground. If you find yourself caught in this cycle of frequent urination, perpetual thirst, and unexplained weight loss, it's crucial to see a health care professional. These symptoms, especially combined, can be indicative of elevated blood sugar levels, pointing towards diabetes. Acknowledging and acting upon these early signs by consulting with a health care provider can be a significant step towards managing your health and preventing further complications. 6. Unexplained weight loss. Unexplained weight loss can be another early symptom of diabetes, particularly in women over 40. When cells don't receive enough glucose, the body starts to burn fat and muscle for energy, leading to weight loss. In type 1 diabetes, the body lacks insulin, which prevents glucose from entering cells, resulting in weight loss. In type 2 diabetes, insulin resistance can prevent glucose from being properly utilized, leading to weight loss. If you're experiencing unintentional weight loss despite normal or increased food intake, it's important to speak with a health care provider to rule out any underlying health conditions, including diabetes. 5. Constant fatigue. Feeling constantly fatigued goes beyond the usual tiredness after a long day or a poor night's sleep. For women over 40, experiencing an unshakable sense of exhaustion could be a subtle yet significant warning sign of diabetes. This type of fatigue isn't just about feeling sleepy. It's a profound lethargy that doesn't seem to improve with rest. But what's the link between diabetes and this pervasive tiredness? The answer lies in your body's struggle to properly use glucose, its main source of energy. When insulin levels are not adequate or the body can't use insulin effectively, glucose stays in the bloodstream instead of being converted into energy. This mismanagement means your cells don't get the fuel they need, leading to a constant state of weariness. Moreover, when blood sugar levels are high, the body works overtime to try to normalize these levels, primarily through increased urination to expel the excess glucose. This not only disrupts your sleep due to frequent nighttime trips to the bathroom, but also leads to dehydration, compounding the feeling of fatigue. Constant fatigue can be debilitating, affecting your daily activities, mood, and overall quality of life. It's a sign that your body is not functioning as it should, signaling a need for a deeper investigation into your health. If you're experiencing this level of exhaustion, particularly alongside other symptoms like frequent urination, increased thirst, or unexplained weight loss, it's crucial to consult with a health care provider. Recognizing and addressing this early sign of diabetes can help you take steps to manage your health, potentially mitigating the fatigue and restoring your energy levels. It's about listening to your body's signals and taking action towards better health and well-being. 4. Blurred vision. Blurry vision or changes in eyesight can be early indicators of diabetes in women over 40. High blood sugar levels can cause changes in the lenses of your eyes, leading to blurred vision. If you notice sudden changes in your vision, such as difficulty focusing or seeing clearly, it is important to consult with an eye care professional and discuss your symptoms, as they may be related to high blood sugar levels and potential diabetes. 3. Slow healing wounds. If you've noticed that cuts, bruises, or sores take longer to heal than usual, it could be a sign of diabetes. Elevated blood sugar levels can affect blood circulation, impairing the body's ability to deliver enough oxygen and nutrients to the site of the wound, leading to delayed healing. Additionally, diabetes can cause nerve damage, affecting sensations in the extremities and inhibiting the body's natural healing processes. If you have concerns about slow healing wounds, it's important to consult with a health care provider, as this may indicate uncontrolled blood sugar levels and potential diabetes. Specific signs of diabetes in women over 40. In addition to the common symptoms of diabetes, there are specific signs that women over 40 should be aware of. These symptoms include 2. Yeast infections. Experiencing frequent yeast infections, especially in the vaginal area, can be a symptom of diabetes in women over 40. High blood glucose levels can create an environment favorable for yeast growth, leading to recurrent infections. Interestingly, the hormonal changes that occur during menopause can also contribute to an increased risk of yeast infections. If you're experiencing recurring yeast infections, it's important to speak with your health care provider to determine the underlying cause and discuss the possibility of diabetes. 1. Polycystic ovary syndrome, PCOS, and its relation to diabetes. Polycystic ovary syndrome, PCOS, is a hormonal condition that affects many women, particularly those of reproductive age. Women with PCOS are more likely to develop insulin resistance, which can lead to higher levels of insulin in the blood. Insulin resistance is a risk factor for type 2 diabetes, making women with PCOS more susceptible to developing diabetes, especially as they age. PCOS is characterized by hormonal imbalances, including increased levels of male hormones, which can further contribute to insulin resistance. Managing PCOS through lifestyle changes, such as following a healthy diet and exercising regularly, is important for reducing the risk of diabetes in women over 40 who have this condition. Practical tips for managing PCOS include maintaining a balanced diet that is low in refined carbohydrates and sugars, engaging in regular physical activity, and maintaining a healthy weight. Certain risk factors can increase the likelihood of developing diabetes, especially in women over 40. Some of these risk factors include being overweight or obese significantly increases the risk of developing type 2 diabetes, particularly in women over 40. Excess body weight, especially around the waist, can contribute to insulin resistance and the body's inability to effectively use insulin. Additionally, a sedentary lifestyle and lack of physical activity can further increase the risk of developing diabetes. Incorporating regular physical activity into your daily routine, along with maintaining a healthy weight, can help reduce the risk of diabetes in women over 40. Having a family history of diabetes can increase the risk of developing the condition, especially in women over 40. If one or both of your parents or siblings have diabetes, you may be genetically predisposed to developing the condition. Understanding your family history and discussing it with a health care provider can help assess your risk and take appropriate preventative measures, such as lifestyle changes, to reduce the likelihood of developing diabetes. Certain ethnicities, such as African American, Hispanic, Native American, and Asian, have a higher risk of developing diabetes. Women of these ethnic backgrounds, particularly those over 40, should be aware of this increased risk and take proactive steps to prevent or manage diabetes. Knowledge of your family's ethnicity and its association with diabetes risk can help inform decisions about lifestyle, diet, and medical care. Gestational diabetes is a condition that occurs during pregnancy and is characterized by high blood sugar levels. Women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life, especially if blood sugar levels were not well managed during pregnancy. Gestational diabetes during pregnancy can serve as an indicator of future diabetes risk in women over 40. It is important for women who have had gestational diabetes to undergo regular health checkups and, if necessary, make lifestyle changes to reduce their risk of developing type 2 diabetes. Blood glucose test. Fasting blood sugar test, also known as fasting plasma glucose (FPG) test, measures blood sugar levels after fasting for at least 8 hours. This test is used to diagnose diabetes and prediabetes, with blood sugar levels of 126 mg/dl or higher indicating diabetes. It's important to note that diagnosing diabetes requires repeat testing on a different day to confirm the results. Fasting blood sugar test, combined with other factors such as symptoms and risk factors, can provide valuable information for diabetes diagnosis in women over 40. Hemoglobin A1C column test. Hemoglobin A1C column test, also known as glycated hemoglobin test, provides an overview of the average blood sugar levels over the past 2 to 3 months. This test does not require fasting and is used to monitor long-term blood sugar control. A1C column levels of 6.5% or higher indicate diabetes, while levels between 5.7% and 6.4% may indicate prediabetes. Hemoglobin A1C column test, along with other diagnostic factors, can help healthcare providers diagnose diabetes and assess blood sugar control in women over 40. Managing diabetes is essential for women over 40 to prevent complications and maintain overall health. Treatment of diabetes typically involves a combination of medication, lifestyle changes, and self-care practices. The specific treatment plan will vary depending on factors such as the type of diabetes, blood glucose levels, and individual health needs. Medication options for diabetes management include insulin injections, oral medications, and other injectable medications. Lifestyle changes, including adopting a healthy diet, regular exercise, stress management, and good sleep habits, play a crucial role in blood sugar control and overall diabetes management in women over 40. Preventing diabetes in women over 40. While diabetes cannot always be prevented, there are steps women over 40 can take to reduce their risk of developing the disease. Here are some key preventive measures to consider. Can regular checkups help detect early signs of diabetes? Regular health checkups, including blood tests, can help detect early signs of diabetes and prevent its progression in women over 40. By monitoring blood sugar levels, healthcare providers can identify potential risk factors and implement early interventions. Regular checkups also allow for discussions about lifestyle changes, risk reduction, and necessary medical care. Early detection of diabetes is crucial as it allows for timely disease control and management, reducing the risk of complications in the long term. Establishing a trusting relationship with a healthcare provider and attending regular checkups are important steps in maintaining overall health and well-being for women over 40. In conclusion, it is crucial for women over 40 to be aware of the early signs of diabetes and take proactive steps towards prevention and management. Frequent urination, increased thirst, unexplained weight loss, constant fatigue, blurred vision, and slow-healing wounds are some of the early symptoms that should not be ignored. Women with risk factors such as obesity, lack of physical activity, family history of diabetes, and a history of gestational diabetes should be particularly vigilant. Regular checkups, blood glucose tests, and hemoglobin A1C column tests can help in early diagnosis. Treatment options include medication and lifestyle changes. By prioritizing their health and making necessary lifestyle adjustments, women over 40 can effectively prevent and manage diabetes for a healthier future. Before you go, remember to like and subscribe for more helpful content. And as a thank you, we've got some incredible free gifts for you. Check out the description below for links to books and resources that can help you manage or even prevent diabetes. Don't miss out. We hope this video has shed some light on the early signs of diabetes in women above 40. Have you or someone you know experienced these signs? Drop a comment below. We'd love to hear your story. And don't forget, your health is in your hands. With the right knowledge and actions, you can make a significant impact on your well-being. Thanks for watching, and see you in the next video.